Before starting this webinar, we'll quickly see a little bit of brief intro about AIESECT Learn. After this, I introduce you Ms. Dr. Raksha Sharma. She is having an industry experience of more than 7 years in healthcare industry, and she is also an alumni of GIM, which is a well-reputed institute in healthcare industry. Ma'am, you can start here.
Hello everyone, a very good evening to all. So I welcome all of you. I hope you all can see me, and let me share my presentation with you all, and we'll start now without wasting much time. Okay, so before starting, I want to say that you all can type your questions in your chat, in the chat box, and I'll try my best to answer each question at the end of my presentation. A very good evening. My name is Dr. Raksha, as I've been introduced by Aman. Thank you, Aman. Thank you so much. Thank you, all the team members. So we are a AIESECT Learn team. So just to brief all of you, Lokesh Anand ji, you are raising your hand. Yes, at the end we'll take your questions, and whatever query you all have, you all can put in the your chat box. At the end of my presentation, I will check the chat box and I'll answer all of your questions. And इस presentation में मैं कोशिश करूंगी दोनों ही भाषाओं का उपयोग करने की, हिंदी और इंग्लिश दोनों, क्योंकि जहां तक मुझे ऐसा लगता है कि हिंदी भाषी क्षेत्र है ये हमारा, और इंग्लिश भी जरूरी है क्योंकि कुछ लोगों को हिंदी समझने में दिक्कत है. तो I'll try to keep bilingual. I'll try to keep my presentation bilingual, हिंदी and English both. But still अगर मैं कहीं पे फ्लो में भूल जाती हूँ कुछ हिंदी में एक्सप्लेन करना, so please remind me, and आप अपना क्वेश्चन चैट बॉक्स में पुट कर सकते हैं कि मैम ये वाला पॉइंट आप प्लीज रिपीट कर दीजिए, या ये मेरा क्वेश्चन है, ये मेरी क्वेरी है. जैसे मैं कुछ क्वेश्चंस ऑलरेडी देख चुकी हूँ. विजय जी जो एनएचएम में ऑफिसर, इन्होंने पीएचडी पब्लिक हेल्थ के लिए पूछा है. श्योरली सर, मैं आपको आखिरी में उसका आंसर डिटेल में करूंगी. जस्ट लेट मी फिनिश माय स्मॉल प्रेजेंटेशन ऑफ दिस करियर अपॉर्चुनिटीज इन पब्लिक हेल्थ, एंड एट द एंड आई विल डेफिनेटली आंसर ईच एंड एवरी all the questions. Okay, so to all the working professionals who have joined today here, and to all the freshers, to all the graduates, my main agenda of this webinar is to explain you 3 points. I want to, मैं इसको बहुत प्रिसाइज रखना चाहूंगी. सर एंड मैम जो भी पार्टिसिपेंट्स हैं, मैं आप सबको सर और मैम से डिनोट करूंगी, बिकॉज आप सब वर्किंग प्रोफेशनल्स हैं. मोस्ट ऑफ द पीपल हु आर डूइंग MPH and MBH kind of courses, they all are working professionals. So either they are working in government sector or private sector or hospital or healthcare organization or everywhere in an NGO or wherever, even in the colleges. Okay, so they I don't assume them like take them as my students. They are like colleagues only. So फिलहाल right now even the Masters of Public Health previous batch which we are running, we have approximately 70 working professionals in there. All of them either they are in the NHM, some कोई government organization में है, कोई private में, but they all are like associated with the very very high profile organizations. So आज जो मेरा वेबिनार है उसका एजेंडा मेनली मैं कम से कम शब्दों में रखना चाहूंगी. बहुत ज्यादा नहीं खींचूंगी, बहुत कम समय में बहुत जल्दी आपको प्रिसाइज करूंगी. सैटरडे नाइट है, आई अंडरस्टैंड, सबकी फैमिली का टाइम है. सो एंड ऑल्सो ज्यादा समय में आपके क्वेश्चन आंसर को देना पसंद करूंगी. तो मेरा मेन एजेंडा है MPH है क्या, क्योंकि कई लोग हैं जिनको नहीं पता है. ठीक है, और हमें कई बार ऐसा लगता है कि हमें पता है, बट वो एक्चुअली हमें पता होता नहीं है. एंड सेकेंड आईसेक्ट क्या है ये अमन ने बता दिया है ऑलरेडी, थोड़ा सा इंट्रोडक्शन में देना चाहूंगी। एंड आपके पास करियर अपॉर्चुनिटीज इसके बाद एमपीएच क्यों करें भाई, दुनिया में हर कोई डिग्री इसीलिए करना चाहता है, कम शब्दों में बेस्ड ऑन माई 10 ईयर ऑफ एक्सपीरियंस इन दिस फील्ड ऑफ पब्लिक हेल्थ एंड हेल्थ केयर, जो मैं बहुत स्ट्रेट फॉरवर्ड बात करने में बिलीव करती हूँ। तो हम सबके लाइफ का एम जो होता है, एक होता है ज्ञान प्राप्त करना कोई भी डिग्री के लिए, और दूसरा हम अपने लाइफ में अच्छा अर्न कर सकें, एक अच्छी पोजीशन पा सकें। तो ये जानना बहुत जरूरी है किसी भी डिग्री करने के पहले कि हम क्यों करें ये डिग्री। तो जो क्या करियर अपॉर्चुनिटीज आपके पास रहेंगी हम उसके बारे में डिस्कस करेंगे, ठीक है। तो फर्स्ट ऑफ ऑल आई वांट टू टेल यू व्हाट इज आईसेक्ट। सो आईसेक्ट लर्न है क्या एक्चुअली, दिस इज द ऑनलाइन प्लेटफॉर्म वेयर वी हैव लॉन्च्ड मल्टीपल प्रोफेशनल कोर्सेस. It includes all the short term and all the degree programs also. So what is public health? Public health is a complete degree program. Okay, it is not a short term certification program or something. AISECT Learn is a platform where we launch, where we provide multiple kinds of short term professional and degree programs. In that, one is Masters of Public Health. Okay. So I have already introduced myself, so no need to repeat this slide. So हम पॉइंट पे आते हैं, पब्लिक हेल्थ है क्या। सो फिलहाल जो हम जिस पब्लिक हेल्थ की बात कर रहे हैं, एमपीएच कोर्स हमने आईसेक्ट लर्न प्लेटफॉर्म पे ऑनलाइन भी लॉन्च किया है फ्रॉम दिस ईयर ओनली। इसके पहले हम इसे ऑफलाइन भी, हमारे पास लास्ट 5 ईयर से वी हैव एमपीएच प्रोग्राम इन ऑफलाइन मोड। ओके, एंड ऑलरेडी 5 बैचेस आर पास्ड आउट, 5 बैच पास हो चुके हैं हमारे यहाँ से, बट वो ऑफलाइन थे। बट समय की मांग को देखते हुए हमारे पास इतनी ज्यादा हाई डिमांड है इस वक्त ऑनलाइन कोर्स के लिए, एमपीएच के स्पेशली, and especially those who are working professionals and they are residing in very far region, south, north, all over the India, even outside the India also. मैं बहुत ही प्रैक्टिकल अप्रोच में आपके साथ ये प्रेजेंटेशन शेयर करना चाहूंगी, ना कि एक रोबोटिक मोड में। मेरे पास अभी एक लास्ट वीक ही एक स्टूडेंट, एक डॉक्टर आई थी, डॉक्टर शायरी। शी इज परसुइंग हर पीजी इन आई थिंक कहाँ से, लिवरपूल से, वो आउट ऑफ इंडिया से कर रही हैं। तो शी वांटेड टू डू एमपीएच। तो उनका क्वेरी था कि मैम मैं ऑफलाइन तो नहीं ज्वाइन कर पाऊंगी क्योंकि मैं बाहर रहती हूँ। तो वो ऑनलाइन के लिए उन्होंने रजिस्टर किया है। तो इस तरह की चीजें को देखते हुए कि भाई लोग बाहर रह रहे हैं, दूर रह रहे हैं, बट अभी फिलहाल एमपीएच की बहुत ज्यादा डिमांड गवर्नमेंट एंड प्राइवेट सेक्टर हर तरह से आ रही है, उसके चलते जितने भी लोग अवेयर हैं वो करना चाहते हैं, जो अवेयर नहीं है उनके लिए भी हमने ये वेबिनार रखा है कि वो जाने क्यों करना चाहिए। तो एमपीएच हमने ऑनलाइन लॉन्च किया है, जिसको आप कहीं पर भी रह के कर सकते हैं डिस्टेंट मोड में, बट दिस विल बी वैलिड एंड इट इज अ फुल टाइम डिग्री। आपको ये बिल्कुल दिमाग में नहीं लाना है कि ये फुल टाइम डिग्री नहीं है, ठीक है। तो एमपीएच, जो जिनको नहीं पता है एग्जैक्टली एमपीएच है क्या, मास्टर्स ऑफ पब्लिक हेल्थ है क्या, ये डील किस चीज से करता है, तो मैं कम शब्दों में बताना चाहूंगी, बुक की लैंग्वेज में नहीं बात करना चाहती हूँ जो समझ में नहीं आती है कईयों को। इट्स अ प्रिवेंटिव साइंस सर। सी, डॉक्टर्स जो होते हैं या जो मेडिकल साइंस होता है वो ट्रीटमेंट पे फोकस करता है। जब आपको बीमारी हो चुकी है, जब प्रॉब्लम हो गई है ना, तब वो उसका रोल आता है डॉक्टर्स का या मेडिकल साइंस का। बट मास्टर्स ऑफ पब्लिक हेल्थ स्पेशली आउटसाइड इंडिया, जो लोग भी आउटसाइड इंडिया से जुड़े हुए हैं उनको पता होगा कि बाहर इसका बहुत ज्यादा फ्लॉरिश हो चुका है, बहुत ज्यादा ये स्ट्रीम फ्लॉरिश हो चुका है। इंडिया में तो अभी फ्लॉरिश हो रहा है, मेट्रोज में भी फ्लॉरिश हो चुका है। ये साइंस है प्रिवेंशन का, मतलब बीमारी हो ही ना, हम कैसे ट्रांसमिशन को रोकें, हम ऐसे कैसे पॉलिसीज बनाएं, कैसे प्लान्स बनाएं, कैसे क्या करें, हमारी टीम कैसे कैसे काम करे कि बीमारी होने से पहले ही हम रोक लें, या फिर बीमारी अगर फैल ही गई है तो उसको हम और आगे करने से कैसे रोकें। यहाँ पे जितने भी डॉक्टर्स होंगे या मेडिकल बैकग्राउंड से होंगे या नर्सिंग के होंगे या फिर थोड़ा बहुत भी बायो बैकग्राउंड से होंगे, उनको पता होगा कि बीमारी होने के बाद हमारे पास सिर्फ एक ऑप्शन बचता है, दवाई देना। हम उसको रोक नहीं सकते, हम उसको खत्म करने पे तुले रहते हैं कि किसी तरह से ये ठीक कर दूं मैं इसको, लेकिन वो ऐसा कौन सा साइंस है जो उसको होने से ही रोक दे। तो मास्टर्स ऑफ पब्लिक हेल्थ कम शब्दों में ये एक ऐसा क्षेत्र है जहां पे जिस डिग्री को करने के बाद आप पब्लिक हेल्थ ऑफिसर, प्रोजेक्ट ऑफिसर या पब्लिक हेल्थ लीड करेंगे। जो मिनिस्ट्री के अलग अलग प्लान्स लॉन्च हो रहे हैं, हेल्थ केयर के प्लान्स लॉन्च हो रहे हैं आज के डेट में, आपके जो भी क्वेश्चंस हैं, जो भी अपने हैंड रेज कर रहे हैं, मैं उनसे रिक्वेस्ट करूंगी आप अपने क्वेश्चंस प्लीज चैट बॉक्स में पुट कर दें। मैं अपना प्रेजेंटेशन खत्म होते से ही आप क्वेश्चंस देखूंगी और उनको आंसर्स करूंगी, ठीक है। तो जस्ट फ्लो ना बिगड़े, इसलिए मैं एक बार विद इन 10 to 15 मिनट्स में अपना प्रेजेंटेशन कंप्लीट कर लूं, देन आई विल आंसर एवरीबॉडी, है ना। ओके, तो ये बेसिकली वो है। अगर आप और डीप में जाएंगे तो बहुत सारी चीजें हैं जो इसमें हैं, लेकिन मैं बहुत ज्यादा डेप्थ में नहीं जा रही हूँ। बस ये जान लीजिए कि ये एग्जैक्टली कोई कम शब्दों में पूछे कि एक डॉक्टर क्या करता है, तो डॉक्टर एक ट्रीटमेंट करता है। इंजीनियर क्या करता है, सबको पता है, उनको टेक्निकल चीजें सही करनी होती हैं। इसी तरह से मास्टर्स ऑफ पब्लिक हेल्थ इज प्रिवेंटिव साइड ऑफ द मेडिकल साइंस। ठीक है, प्रिवेंशन पे काम होता है यहाँ पे। इसका हमारा मेन फोकस प्रिवेंशन पे है। कोविड आया है उसके बाद से इसकी डिमांड बहुत ज्यादा बढ़ गई है, पहले भी थी पर इंडिया में स्पेशली छोटी जगहों पे इसके लिए अवेयरनेस उसके बाद ही ज्यादा आई है। तो एमपीएच प्रोग्राम एम्स टू डेवलप स्टूडेंट्स कॉम्पिटेंसीज। इसमें क्या क्या आपको कॉम्पिटेंसीज या स्किल्स पे फोकस किया जाता है मास्टर्स ऑफ पब्लिक हेल्थ में? एपिडेमियोलॉजी एक अलग ही बहुत ही डिमांडेड क्षेत्र है इसका, बायोस्टैटिक्स, इन्वायरमेंटल साइंस, पब्लिक हेल्थ बायोलॉजी एंड पॉलिसी ऑल्सो, हेल्थ मैनेजमेंट एंड फंक्शनल मैनेजमेंट, सोशल बिहेवियर साइंस, पब्लिक पॉलिसी एंड एथिक्स। ठीक है ना, कुल मिला के इसमें आप जिस भी स्टेट में पोस्टेड होंगे या इंडिया लेवल पे पोस्टेड होंगे या जिस भी लेवल पे पोस्टेड होंगे, ब्लॉक लेवल पे पोस्टेड होंगे, आपको आपके आसपास की जितनी भी सोसाइटी, पॉपुलेशन, जनता है, डेमोग्राफी है, आप में से कुछ लोगों जिन्होंने पब्लिक हेल्थ थोड़ा सा पढ़ा होगा उनको पता होगा मैं क्या बात कर रही हूँ। आप जब कोर्स करेंगे तो ये सब चीजें आपको समझ में आएंगी। उसके बारे में एक एक चीज की जानकारी लेना, डेटा अपने पास रखना, उसको इवेल्युएट करना, आने वाली बीमारियों को पहले से ही समझ लेना कि क्या क्या प्रॉब्लम्स आने वाली है आज से 1 साल बाद, उसके लिए पहले से ही तैयारी क्या चाहिए हमारे हॉस्पिटल्स में, हमारी सरकार को। ये होता है काम एक पब्लिक हेल्थ प्रोफेशनल का। आई थिंक
Ma'am, sorry for the interruptions. Many of the participants are asking to be for the English language.
I'm very happy if they are asking for the last time it has happened that I think one webinar also we have taken, in that they were asking me to explain in Hindi, so I am a little bit confused. So okay, yeah, all good. In English I'll be briefing. Okay, yeah, Savita Saviji, yeah, definitely epidemiology I'll explain you, and MPH MHA job में क्या difference है, that Sangnika ji, that I'll explain you in the last. Okay. Okay. So yeah, we'll continue in the English. So it is a bit confusing here in MP. Before this, I was in South, so there they wanted English, and here students ask me to speak in Hindi. So I'm a bit confused which language to use. But yeah, it's okay. We'll start. Okay. Yeah. So who are eligible and what is the pay structure? Eligibility is written in front of you, but in less words. Especially you should be having some kind of the healthcare, allied health, paramedical, like doctors are eligible. That's very, very clear. But except them, everything which is related to healthcare or medical science or something related to society or community or something related to life science. Okay, they all are eligible for doing the MPH course. Okay. So, and the fees structure is 60,000 yearly, and for 2 years it is 1,20,000, and you will be having 4 semesters. In the 2 year of program, you will be having 4 semesters, 4 exams. Okay, the number of exams will be 4, and in every semester you will be learning different subjects like epidemiology, public health policy, advocacy, biostatics, research methodology. Like there are ample of 26 courses. We follow the curriculum of the teleministry MPH program. Okay, now the answer, it is very clear what is MPH, I hope. Okay, I hope it is very clear what is MPH, what is public health. Now it is all clear to everyone. Okay, now coming to the point, why we are doing this webinar out of the blue, like suddenly, why everywhere MPH, or like wherever we are seeing vacancies, bulk vacancies are seeing for the public health professionals. Why, like, what is the reason? Like, there was an era when people used to say MBBS or engineering is they were on boom. But right now, the public health, why it is on boom? Only one answer I have for this. Because whole night or whole week we can discuss on this. This is so vast. The area is so vast. And especially for me, I have spent my life on this. Like it's been like 5 year or 2 year of studies, then 10 year of working. So I can speak on this for like longer hours, but yeah, in less words because we have time limit. The main reason to boom all these courses is sudden random pandemics, which you are seeing since 2 to 3 years. Okay. Before that also there was a need. But our government or ministry or like they all were aware, but they were not that aware like, oh my God, the condition will be so bad if we will not focus on public health part. Everybody was focused on medical college, open the medical college, open this medical part. Okay, it is also a medical part, but it is not a treatment science. It is not a clinical. It is a preventive science. How to prevent? How to prevent the transmission? Okay, so the reason for booming of this public health field or public health requirement in the country is sudden rise in the unexpected, surprisingly random pandemics, and also the other reason is lifestyle diseases, or you can say non-communicable diseases. There is a people who are from the medical background, they must be agree with me, they will be agree with me that there was a time India's main headache was a communicable diseases. But now the biggest transition we are witnessing, the main headache is, and in the coming time will be the lifestyle diseases or the non-communicable diseases. The only answer to those kind of diseases are prevention, all the precautions what we can take. So these all comes under the part of the public health, like cancer, diabetes, hypertension, BP or cardiac issues. Those all are the non-communicable, or you can say lifestyle diseases. So this is the main reason why it is booming, why it is growing nowadays. And it is a beautiful blend of this course is a beautiful blend of the health, management and aesthetics. In this course of 2 years, you will be seeing the subjects which are related to health, some are related to management, and some are related to statics. Because why? There is a reason. You have to learn how to manage the healthcare sector. You have to learn, because right now in the COVID, the most, you can say the biggest issue what we have witnessed is that doctors were busy in treating the COVID patients, or whatever disaster was going on. There was nobody to manage the scarcity or see what we can need, how much we can need, how we can manage things so that things can go in a smooth manner, or how we can plan in beforehand. From before it comes to on our head, we should be ready to there should be somebody who can forecast, who can see that in upcoming time there will be problems related to these kind of diseases. This is the job of the public health professional. So this is why the sudden demand in the public health has been seen. Okay. So also the other reason for rising demand of the public health is government has ordered, after this all have seen, that each state or each at a block level, state level, district level, there should be some data expert, public health expert, data expert, and people, epidemiologists should be there. And you won't believe, as per the right now the data we have of the each state and district, there are not enough. There is not a single state you can tell me that, ma'am, here all the vacancies are full of the epidemiologists or public health professionals. This is the truth I am telling you, the latest truth. Okay, vacancies are going vacant. There are lots of vacancies, bulk vacancies are for the epidemiologist, public health professionals, and health communication officer, project lead. There are like n number of vacancies are going vacant. And also after this whole disaster which India has seen, government has announced public health that, like you have seen, Army and CRPF have their own cadre. They have their different cadre. You must have heard that Army cadre. So in that way, government has ordered, or they have planned to launch that public health management cadre. In that, they will be having different departments, different streams. Okay, there will be public health. There will be mainly 3 sectors: public health management cadre, hospital administration cadre, and also the cadre which will be dealing with the core management. So what is the difference between these 3? What is the main difference between these three? Public health management cadre will be dealing with the prevention and transmission of the ground level of the disease at the ground level. Okay, they will be mainly into the health and clinical. And the hospital management cadre, they will be dealing with the all the resources inside the building. Inside the building, if things is on our head, if diseases is on they have come on our head, how to fight with that, then all the resources should be there. They will be dealing with that. And the core management, they will be dealing with the non-health part, because management is of health and clinical is not only the headache of the hospitals or healthcare. Also, we need to see about the budget and everything in the building, manpower, and there are lots of things which will be seen by the plain management people. Okay, so this is the reason right now country needs lots of MPH graduates, postgraduates, and also the PhD in public health, because higher the degree, higher the expertise, you will get the higher post, you will get the higher responsibility, you will get the higher salary. It is equal. It is very clear. Okay. Now coming to the what are the career opportunities in this after doing MPH? Very simple question. What is the career opportunity? What we can become, what we can earn, how much salary we can earn, what we can become. Okay, so basically this is also very vast. Okay, I'm telling you, in my career of 10 years, I have been working in a corporate, healthcare corporate, academics also, research also. So there are ample of things which I will tell you. Okay, so basically I will tell you 3 streams are there where you can work. Okay, there are hospitals, there are NGOs, there are funding agencies, knowledgeable firms. They all are they all right now. If you search on Google public health vacancies, a very practical thing I'm telling you, you will get all these lined up options there. Hospitals, NGO, funding agencies, medical device, pharma, they all are launching and they all are releasing vacancies. Except that the kind of profile which you can have after doing MPH is basically, first is academics, second is research, and third is your practice, public health practice. Listen to me very carefully. In these 3 sectors, you can go after doing MPH. First is academics, based on your interest. That I will explain what you can do in academics. Then second is research. I will explain what all comes under the research. And like based on your interest, if you're interested in academics, if somebody is interested in research, and if somebody is interested in kind of practicing. Okay. And third is practice. What is practice? Government and non-government. In government, there are different posts where you have to work on the public health projects, and there are non-governmental profiles also. That also I will give you the example and explain you. Okay. So academics, in academics, what you can do after MPH, you can right now I am working as an HOD public health department. Okay. And also I teach, also I manage things. Okay. So if you are interested in academics, then I would tell MPH is gold mine. Why? Right now, in very less words, I will tell you, if there is a need of 10 potatoes. Okay. So definitely I will have to go and sow the seed of 10 potatoes. So right now, if the India is in need of the public health professionals, then definitely there will be ample of colleges and universities will be opening. And if colleges and universities are opening, there will be vacancies for the teachers and faculties, for the HODs, for the deans. It is very clear. So if you are interested in teaching and going for things, then this is the best field you can do. But yes, in that PhD is very, very much required. Okay. After MPH, you will be getting a handsome salary and good post. But yes, PhD is as per the UGC, PhD in public health also is needed, but that you can do while teaching also. Okay. There are right now in India, 40 to 50 public health institutes where you can apply and you can get a very good salary as a faculty, and you can teach and you can pursue your PhD also. That is a very decent. And right now there is a more demand in academics for the public health professional than any other degree, because in any other field there is a saturation, but in MPH there is not a saturation for upcoming 10 years. I'm telling you, you can write it somewhere. Okay, and then coming to the research, people who are interested in research driven mind. Okay, they want to do something new for the society, they want to help the society, they want to do something like there is a person who want to find some solution to the upcoming problems. Okay, so research is a very good field. Let me give you a very good example. ICMR, they need, like, they're hunting for the research scientist in the public health field. Right now India has, if 100%, like for example, in 100% of research, only 32% of research is for from the public health, and that too, let me tell you, is from the international side. India's public health research contribution is very less, because research scientists in the public health field are very less, because people are not there who are very expert in the public health. They are very, very less and renowned people at Delhi or South, or like very, I can very, very less people. You can count on your fingers. So if you are into research after MPH, you can be a part of the ICMR kind of organizations where you can work as a research scientist and you can get a good salary, and your passion for the research also can be fulfilled. And that is the field, very frankly, I want to say, very less people want to go into the research. And where people who where the people people who want to try less, there is a lot more opportunities are there for you, because you will be the only player there. So research is also a field. And then coming to the practice, in practice you will be having two fields: government, non-government. In government, there are posts like in charge of the health program, in charge of the health policy, launched by the ministry. Our ministry is they are launching continuously different health programs. For that, they want in charge, director, head. And let me tell you, recently, I think last year, there was a post at a block level. Salary was around, I think, very good salary. And I know from my colleague, she is working in Delhi NHM. She told me that is vacant since like 6 months. Nobody is there. Like, people who are applying, they are not eligible, and like they are lacking the eligible people to fulfill that post. Okay, so people who are experienced, people who have work ex in the healthcare, people who are doctors, nurses, physiotherapists, or like from different field, based on their expertise and based on their like what kind of degree they have, we have public health sector, in government and non-government both, different kind of posts are there. Like if somebody is MBBS plus MPH, they will be getting some different kind of profile. Nursing plus MPH, BPT plus MPH, or MSW plus MPH, or some kind of homeopathy. Like there are different fields, no? Pharma plus MPH. So for everybody, there is a lot, like different kind of profiles. There is no lack. Nobody will be in lack after doing MPH, because country is hungry for the MPH people right now. Okay. And in the non-government, what you can do, like if you are aware, nowadays every college, private university, or private corporate sector, even Accenture, Infosys, all the high any company, there is a mandate to do the CSR activities, if you are aware or not, corporate social responsibility activity. Under that, they have to donate something into the health and education. So to deal with that public health CSR activity funded part, they need MPH people, because people who are with plain MBA degree, or people who are doctors, they are not able to communicate, understand, and take things forward at international level. This I have seen personally when I was working in corporate in South. So they need, and they provide very, very high package, let me tell you. I don't want to disclose my package, but yes, you will get a handsome salary. Okay. So that is also, and there are NGOs where you can work. Okay, so this is the kind of profile is empty, and it is calling all the MPH people, all the PhD in public health people, come and join. Okay, this is the common career path, which already right now in my speech, in my I have explained. Okay. Research, public health managers, and all. And this is the snapshot of salaries which person gets. Research scientists get very, very handsome, there is a career path. See, it depends on like kitna aapka how expert you are, how much experience you have. Okay, it starts with the like around 5 to 6 lakhs, but there is no limit. Okay, I know some people at the country head. There is a person who is a country head right now at Japai, and he is like earning around nearly a crore of like a package. Okay, so like we cannot say there is a limit. This is the salary. You can say, you can see different biostatician, you can become management policy advisor, you can become disaster specialist, you can become based on your what kind of interest you have, what kind of previous experience you have, what kind of graduation degree you have. According to that, this profile, you will be selected for this kind of profile where you will be suitable. Okay. So there are some challenges also, guys. Okay. What are the challenges? The only challenge is that person who is not into service mindset, if you are not oriented for the society, social work, service to needy, you have to work in challenges, like there will be disaster, there will be COVID kind of condition, there will be situations where you have to work in day and night in pressure sometimes. Okay, I'm not threatening you that all the time you have to work like that, but once in a while, okay, like COVID has come once in a while, so once in a while you have to be ready to work in challenges. Okay, so it is kind of that, and at last it requires lots of passion to serve the society, to work in the healthcare sector. You don't feel bored, otherwise you will not be able to work in this sector. Okay, you should have that kind of empathetic nature towards the society, towards the healthcare. That is, then only you will be touching the horizon or peak of your career. And I'm telling you again and again, in any other field of like medicine or a doctorate or engineering or any other field, there is there will be struggle. You will have to fight a lot because there is saturation. But these is field of public health and hospital administration, like there are fields which are new right now growing in India, and there is lots of scope if you have talent, if you have passion, if you have expertise, if you have that kind of degree even. And I don't want to expose the name of my student. He got selected. He just passed out last year doing MPH, and he got selected this year in a government program of healthcare. And he was very skeptical that, ma'am, I have done this from yahan se and from this place. I have not done from branded this and that. Like, he has some plans, but he got selected. So I'm telling you, your selection and your growth solely 100% doesn't depend on the degree, but also depends on how much passion and knowledge you have, and also the kind of faculty, the kind of teacher you have in your life. That I'll add on, that I'll definitely, that changes the game. Okay, so this is all students or like participants, sir and ma'am. So at the last, I'll say Aman or Bhumika to open the room for like, this is all from my side, and I welcome all of you to join the tribe of the healthcare management. And this is not for my personal benefit or for my organization. Yahan pe I want to be very selflessly, I am telling you to all of you, please do MPH. Right now, MPH is in boom. I'm from that background only, and I am telling you, there is a lot. It is a gold mine, hot cake right now. Please do MPH. And why from AISECT Learn? Because you can do it from anywhere in the city or in the state or in the country. And the second reason is me. I am a very devoted faculty, and my students are very happy. Right now, I have 70 students of batch of MPH. They all are like very happy, and they are getting knowledge, quality, and everything. So this is all, sir and ma'am. And here I will stop.
Thanks a lot, ma'am. Thank you so much. So thanks a lot, guys, for attending this webinar. once you will start getting into the MPH, believe me, the sky is the limit. You will gain whatever the salary you are looking for as you gain experience in the industry. So before ending this webinar, we are having a few polls here so that we can understand you guys better. And if you are interested into the courses, definitely you can go ahead. Our team will surely reach out to you. Okay, someone has dropped their contact number as well. Surely our team will reach out to you. Guys, we are having quick polls here. Just answer those polls so that we can understand you better. And when our calling team is there on call, they can guide you properly as well. You have to write whatever the educational qualification you are having. Abdul will share the fees and other details as well. Just after all these wrap up, just after getting all these answer of the polls, we'll surely share the details with you of the course as well, and we'll share you the course link as well so that you can understand in a better way. Okay, so guys, there is quick update. आप में से जिस किसी पास भी कुछ questions है, if you are having questions regarding to the courses, regarding to MPH in general and whatever the future is, you can raise your hand and our team will surely unmute you and ma'am will answer your questions.
Shall I start with the question answer round?
Yes, ma'am. I am just quickly unmuting them one by one. Firstly, we will have a question in the chat box.
Yeah.
This question is from Miss Savita, and she's asking that is this degree is internationally valid or not?
So this
Yes.
degree all over the world is this degree is recognized and valid for all over the world, ma'am. And the reason for launching this course at AISECT Learn, the reason was this only because some students was outside India. They wanted to pursue this course actually. And we have offline course already, but they were not able to join us. So we have launched this course who are outside India. Basically, we have like a very good number of students with us who are doing degree residing outside India. So yes, ma'am, this is valid all over the India.
Okay, ma'am. Next we have Dr. Athiya Jyoti, and she has raised her hand.
Hello, good evening, madam.
Yeah, good evening.
Yeah, I'm Dr. Aditya. Actually, I have a doubt, like this is an online or offline one?
Ma'am, this AISECT Learn is an online one.
Okay. Will this come under MCI recognized one?
Yes, ma'am. This course also and offline one also. Both the courses recognized by the MCI.
Fine. Just one query, like what is the difference between MD, MPH and the MPH, madam?
MD, MPH and?
The MPH which we do.
Like two courses you are asking, no? MD and MPH.
Yeah.
So, ma'am, So, ma'am, MD is basically they will be focusing to to make you a specialist in one disease to treat the disease. But in MPH, you will be becoming the specialist of preventing the disease. How you can at ground level go and plan the policy, plan the strategy in a way you can prevent that disease. But in MD, they will, like for example, a cardiac specialist. In MD, they will be teaching how to treat or how to give the medicine or how to treat the cardiac diseases. But here in MPH, you will be learning what policies, what strategies, and what I can do on beforehand to prevent this disease.
Okay. No, madam. My query is like we have MD, MPH also, right?
No, we don't have MD, ma'am.
No. We have in Delhi. We have in Kolkata actually. MD, MPH is available.
But here we don't have, ma'am.
No. I'm asking what is the difference between that and the MPH and the other side is the MPH. What is the difference between both?
Basically, I'll be very frank here. I haven't heard about MD, MPH. This is the new term for me. But as per my understanding, what I am getting, because it is very clear by the listening the term only, MD, MPH. Will be the blend of medicine. It is basically they would have launched it for the doctors who don't want to leave MD and also they want to do MPH. So I think, as per my knowledge, people who are doctors and who want to continue MD and they also want to do MPH. In that case, they will be blending the public health management few subjects courses in the MD, and they have launched MD, MPH. Okay, but ma'am, let me. As per my knowledge, what I have, the kind of demand government is asking for, For the public health professionals, they will be considering basically MPH only. And if you are focusing on MD, MPH, you will be hired. But for the clinical side of it will not be solely for the public health professionals. It will be on the doctor side. Okay. Are you getting my point?
Yeah. Sure. So as for now, this is MCI recognized and it will be certified as an MCI recognized, right?
Yeah.
Fine, madam. All the course details will be sent to the number, the same WhatsApp number, right?
Our team will surely share all the details with you.
Okay, madam. Thank you. That was a good approach, madam. It was very nice. Thank you.
If you are satisfied, my whole motto is being done. Please,
Yeah.
Next question. Anybody?
It was a good one. Thank you.
Okay, ma'am. Next we have Mr. Vijay Kumar Soni. He is having a doubt. I am just unmuting him so that he can ask whatever the question he is having.
Hello, sir. This is Vijay Soni here from
Yes,
Program
sir.
of National Nutrition.
Hello, sir.
Ma'am, actually, I have done my MPH.
Okay.
And now I want to do public health, PhD in public health.
Okay.
Is there any opportunity in AISECT University to
Yes, sir. We have started PhD in public health last year only, and we already have one batch running. And yes, we have guide who is like a specialist from IHMAR. Like he already been, he has his PhD from IHMAR. And yes, we have PhD in public health, and the fees 3,18,000, and it's of 3 years.
3 lakhs? How much fees?
3,18,000.
Okay, ma'am. One thing is that actually public health cadre is not decided to Government of India and Government of MP. Public health demand is already always in demanding, but in MP, in UP, Bihar, Jharkhand, there is no scope. Public health managers की vacancy NHM निकालता है in just a salary in 15,000, 15,000 रुपया. अब आप सोचिए जरा, just think about that कि क्या है यहाँ पे public health का कोई कैडर ही नहीं बना रहे हैं यहाँ पे.
No, they will make, sir. They will make by the like it is like मैं आपसे से आप बहुत ही informal बात कर रहे हैं, तो मैं भी आपसे informal होना चाहूंगी. अभी लास्ट ईयर सितंबर में हमने एक वुमेन एम्पावरमेंट का प्रोग्राम किया था. तो हमने यहाँ की जो IAS ऑफिसर हैं स्मिता जी, उनको रिसीव करने गई थी मैं. तो शी टोल्ड मी, शी जस्ट आस्क्ड मी कि आप किस फील्ड में हैं. मैंने कहा पब्लिक हेल्थ में. तो शी टोल्ड मी इंटरनली कि तो बहुत काम हो रहा है. बाय द नेक्स्ट ईयर वी विल बी हैविंग बल्क रिक्रूटमेंट विद अ गुड अमाउंट. अभी तक नहीं था सर, आप सही बोल रहे हैं. मैं कुछ साउथ में काम कर रही थी अभी तक. MP UP बिहार में बहुत बुरी हालत है. बट सर मैं आपको बता दूं, अभी आने वाले समय में MP UP बिहार में भी दे विल पे गुड. बट
गवर्नमेंट सेक्टर में होगा क्या?
सर होगा, आप लिख के ले लीजिए सर. आप मानिए मेरी बात, अभी तक नहीं था. आप सही कह रहे हैं. मेरे भी सारे लोग हैं जो सफर कर रहे हैं, बट अभी बिल्कुल होगा. अभी नेक्स्ट ईयर तक दे हैव वेरी गुड प्लान्स. मेरी एक फ्रेंड डॉक्टर मंजरी दिल्ली में काम करती हैं अपनी इसमें ही हेल्थ पॉलिसी में. वो कह रही है कि MP UP बिहार के लिए स्पेशल कैडर बन रहा है. तो है सर, अभी है काफी रिवोल्यूशन आने.
बट मैं उस पर भी बता दे रहा हूँ कि उस पर भी सेग्रीगेशन क्या हो जाएगा कि MBBS प्लस MPH मांगा जाएगा.
नहीं सर, मैं आपको बता देती हूँ 3 कैडर बनने वाले हैं. एक बनने वाला है डॉक्टर्स MBBS MPH जो आप
4 बन चुके हैं मैडम. 4 एक प्रोग्राम.
वही कह रही हूँ.
मेडिकल फील्ड एंड पब्लिक हेल्थ एंड एक हॉस्पिटल मैनेजमेंट. 4 बन चुके हैं. पॉलिसी बन चुकी है और वो इम्प्लीमेंटेशन में अभी 3-4 लिस्ट आई है. जस्ट बिकॉज कि आई एम वर्किंग विद एज अ DPM.
हाँ, आप सही कह रहे हैं. वो 4 बन गई हैं. लेकिन सर मैं आपको बता दूं एक और बात. ऐसा होता है कि सर जैसा हम चाहते हैं वैसा हमको मिले. ये सरकार की अपनी प्लानिंग है सर. मैं जितना अनुभव रखती हूँ इस फील्ड में, आप भी मुझे अनुभवी लगते हैं. जितना सरकार चाह रही है उस हिसाब से उनको जब कैंडिडेट नहीं मिलेंगे और ना ही मिलेंगे, नहीं हो पाएगा सर उनसे, है ना. तो फिर वो जो मिलेगा ना उसमें उनको दे हैव टू हायर. एंड इट इज अ राइट नाउ हाईली लाइक एडवाइजेबल एंड स्ट्रिक्ट ऑर्डर बाय द गवर्नमेंट. दे हैव टू फिल द वैकेंसीज एट ब्लॉक लेवल, एट स्टेट लेवल, एट एवरीवेयर फॉर दिस कैडरे.
ओके
जी. पब्लिक हेल्थ PhD के लिए भी अमन जी प्लीज विजय सर से आप डिटेल्स शेयर कर लीजिएगा.
मैंने ड्रॉप किया है अपना नंबर मैडम. अगर मुझे ऐसी कुछ अपॉर्चुनिटी होती है तो मैंने अभी JRF नीट भी दिया था. मुझे 2-3 यूनिवर्सिटी से कॉल भी आया था
जी.
तो बट अभी हो नहीं पाया कुछ. अगर ऐसा कुछ होता है, मेरे एक फ्रेंड ने बताया था मुझे AISECT के
आप प्लीज मुझसे अपना आप मुझे पर्सनली कांटेक्ट करिए. आई विल डेफिनेटली गाइड यू सर. आई हैव लॉट्स ऑफ अपॉर्चुनिटीज टू टेल यू.
आई डोंट हैव योर नंबर. मैंने अपना नंबर दे दिया है. अगर प्लीज अगर हो सके तो मुझे मैसेज कर दीजिएगा.
डेफिनेटली सर, डेफिनेटली आई विल कांटेक्टिंग यू बाय मंडे सर.
Okay. Thank you.
Next question, Aman ji, देखिए कोई है क्या?
Yes, ma'am. There are a few people. Let me just unmute them.
Hello,
Hi, sir.
ma'am.
Yes.
Ma'am, currently I'm pursuing my master's in public health. I'm a first year student
From where?
from Pune.
Okay.
And my interest in the career is towards the implementation of health policies, measuring the impact of health policies until now. So I wanted to know what kind of internships opportunities I should look into so that it will help my further academic course.
Ma'am, for the research project or kind of thing, what you can look for is definitely you are doing. You have chosen a best field of policy, because right now policy is the main focus for the government, and my only suggestion is to that right now government is trying to eradicate many, like they want to bring kind of budgeting where they can focus on equal amount of like policy. You said no, you have chosen the policy, health policy, so they want to see
Yes.
India free from the kind of these kind of COVID kind of diseases, where they can work upon, but they don't have budget right now, frankly speaking. Okay, so kind of policy or research you can do, survey you can do of all the healthcare professionals, where they can share their views, like because nobody is asking to them. Okay, how the budgeting and how the economist can plan their things, so that we can see in future by that policy a disease free India, that I feel need to work on. Like you should focus on these kind of research.
And ma'am, what are the agencies that I can go? Should I approach that will help me to?
Ma'am, mainly you should focus for the survey or sampling. You should focus on doctors, hospitals, NGOs, and all the people, economists especially, ma'am. Don't forget to include the economists and hospital managers.
Okay. Thank you, ma'am.
Okay, next question, please.
Ma'am, also I would like to get in touch with you regarding the further.
Anytime, ma'am. Anytime.
So how do I reach out to you?
Aman, please help her how like.
Ma'am, we are going to connect with you, so don't worry. We ourselves will connect with you.
Okay. Thank you, ma'am. Thank you. Please, next question. Please ask anybody.
These are the basic questions which we have, like the people who have raised their hand for the queries. So lastly, there is this course which you can let everyone know about. Yeah. So guys, this is the course that is Masters in Public Health, and the batch is starting from 22nd of May. For you people who are into the webinar, you can get 10% discount by using the code MPH10. And for other details, I am dropping you the course link along with all of the coupon code and everything in the chat box. You can just click on the link and check out the course, so that you can have a clear idea about what you guys are going to study about. And if you have any other queries or questions, you can directly reach out to our team, or you can drop your contact details. Our team will surely reach out to you. I have dropped a message in the chat box where I have mentioned the contact details for our team. You can just call on the specific number and ask whatever the query you are having. So for this course, you will be getting a proper 10% of discount, and the final fees will be of 1,08,000. And this course duration will be of 2 years, and we'll be having 20 live and practical sessions as well. Okay, we are still getting contact details. Our team will surely reach out to you, not an issue. If you guys are having any query, you can get our number from the chat box, and that's how you can go ahead. Okay. So we are having Raksha ma'am, are you there?
Yeah, I'm here.
So there is a question from one of the attendees, and can you unmute yourself and ask the question?
Yeah, ma'am. I have completed my Bachelor of Physiotherapy. Actually, I am working in upgraded PHC, ma'am, as a physiotherapist now in Tamil Nadu. So What about the job opportunities in regarding in Tamil Nadu, ma'am? I don't know actually. In other states also, I don't know. This is new for me actually. So I want to know it.
So yeah. So
I'm working in a central government scheme only, NHM only, ma'am. I'm working under NHM.
Money, you want to work only in Tamil Nadu, if I'm clear, if I'm right, right? So if I am right, you want to work only in Tamil Nadu and in NHM only. Okay, so this is the very plus point with you. You should not doubt your career, because the people who are in the private, they have to think which sector to join. But in NHM, in government, they have ample of public health vacancies are coming up. If you are a physiotherapist, please pursue MPH. Okay, you can join us online for this course, and while working as a physiotherapist in your job, you can complete this degree, and this degree is valid, and it will be taken equal as this full-time degree. Okay, right now online and offline, they all are equal. It should be degree only. It should not be diploma. It is a degree. It is a 2-year full-time degree.
My question is, sometimes it is not accepted by the government. That's why I have some hesitating.
No. Let me tell you, I'm not guiding you wrong. They do not accept 1-year diploma or certificate of public health equal to degree.
Yeah, okay.
2 year of full-time degree online, they will count as a degree only.
Okay. Because I have told
there are people who are doing 6 months of diploma or 3 months of certificate course. It is not equal to degree.
Yeah, okay. What about the job opportunities, ma'am? It is going to be high, or because
what?
I'm not heard this MPH.
I haven't heard you.
Job opportunities in Tamil Nadu, ma'am. Do you hear me, ma'am?
Beta, in Tamil Nadu, in South, everywhere, there is a surge, there is a vacancy. I will share, like, you please search on the Google public health vacancies in the Tamil Nadu. You will get. I was working in I think 6 years. I was there in South.
Which state, ma'am? May I know?
I was in Sankhedi, Goa, and also in Bangalore, and also for some time for a few period 6 months of period, I was there in that village area. Also, I was posted. So there is a vacancies. You don't doubt MPH.
Actually, ma'am, in NHM they are giving only low salaries.
But why you are focusing only in that? If you are experienced, you will get a good salary with time. You should have patience. I have kept patience for 10 years. Then only I am getting good salary, na?
Yeah, that's why, ma'am. Because now it depends upon our economies only, That's why
you will get. In public health, they have money. They will give you. Just get experienced, get a degree, and get some good confidence. They will definitely give you.
Okay, ma'am. I need some more details, ma'am.
They will be sharing, and just join this course, and definitely it will help you, beta. Right now, whatever situation you are, from that you will be on a position only.
Okay, ma'am. So someone will contact me on Monday. Is it possible?
Yeah.
You can drop them via my WhatsApp number. I dropped in chat box.
Yeah, Mani, we have got your contact details. Our team will surely reach out to you on Monday in working hours. Okay?
Yeah, okay.
Thank you. So, ma'am, this is it. Guys, if you have any queries, you can reach out to us through the number which is in the chat box, or you can visit www.iseclearn.com and you can fill up the contact form, or you can reach out to us through social media. And if you are having any other queries, we welcome your queries via mail or via DMs. And if you are having any query related to course, our team will surely reach out to all of you interested guys on Monday in the working time. And if you have any query, you can ask to them directly. Okay. So with this, we are wrapping this webinar. We are having another hand raise. Ma'am, can we quickly take 2 more minutes so that we can answer another question from
sure, please.
Yeah, you can unmute yourself and ask the question. After this, we will be wrapping this webinar.
Hello, ma'am.
Yeah, hi, Ruchika.
Ma'am, I want to make it clarity that there is a course from Ministry of Health and Family Welfare about this MPS, this certificate course, and this also
Yeah,
the
I'm
diploma.
aware. Yeah, I'm aware.
Yes. So you told that they don't consider this MPH means they consider only the full time degree and this online degree one, and they don't consider diploma and the certificate courses among them. So isn't the if some particular aspirant has come and they have the diploma or certificate from this Ministry of Health and Family Affairs, and others have from the private institution, won't the Ministry of Health and Family Affairs, the person will get the most favor rather than in spite of not doing this MPH and doing a diploma?
It depends on where you are applying. You are asking in consideration with the ministry only?
No, rather in
Anywhere.
every place I consider, because I am a dentist and I went to a for a job in a pharmacovigilance field at a particular place in Chandigarh, and I did my postgraduate diploma in clinical research from Sikkim Manipal University, and there was another aspirant who did from this Ministry of Health and Family Welfare. So she was considered more over me. Rather, I got a job because of my interview and clarifications, but still after I have to leave because of my marriage purpose. That was another reason. But she was given preference. So you told her that they don't consider, they will not consider.
Let me answer you now. It is very clear, ma'am. See, it depends on what are the options in front of me. For example, I am the person who want to hire, and in front of me there is a person who have some kind of certification or diploma from the government ministry, and somebody is from the private clinical research degree. Definitely, I will hire the person who have the certification from ministry. But let me tell you, here the comparison between the two diploma or two certificate courses only. What I am telling you, you haven't got my point. Degree is far above always than any kind of the certification or diploma. Okay. So if you have done some full-time degree, like this MPH online degree or degree, if you would have done that at that moment when you were going to like this interview, they would have given you more importance than her, because then the comparison between the degree and certificate would be there, right? But as you are saying, in that condition, definitely she would be given more importance, because you both are having the diploma or kind of, both of you are having kind of certificate or diploma. But she is from ministry and you are from private. So that's why they have given her more importance. First answer. Second answer, always, again, I will repeat the same line, that full-time degree, be it online or offline, but degree would be given more importance than any kind of certificate and diploma. And right now in the government, for the public health professionals, they are asking for the degree, and definitely person who is having diploma or kind of certificate, they will be given kind of role, but not above than degree.
I guess, Ruchika, your question has got answered clearly by the Raksha ma'am. Guys, so this is the end of the webinar. Our team will reach out to you, whoever you are interested, and whoever the student have shared their contact details in the chat box, our team will reach out to you. Other than that, if you are having any issue or query, you can just reach out to our team through the contact details which we have dropped in the chat box, and this will surely reach out to your chat box on the WhatsApp as well. This was nice with all of you guys, and from by this we are ending this webinar. Thank you for joining.